Hey folks, Dr. Joe here. Glad you're with us today. Hope everyone's having a good day. I got to talk about something near and dear to my heart, of course. I'm pretty good at this stuff. Is back pain. Why does my back hurt? And about 80% of the people, according to statistics, will miss work at some point in their lives due to back pain. And it's the number 2 reason why people do miss work. Number 1 is cold and flu. Number 2 is back pain. So we're going to talk about what causes it, the real causes of it, and then more importantly, what do you do about it? Things you can do at home as well, and hopefully save yourself some money, some time, some aggravation. So the way this works, I am going to talk for 24 minutes. You, whatever platform you're on, we've got a lot of platforms running right now. You can then ask any questions you have. Just type it in your platform. Garrett and John at the 24-minute break will then read me the questions. I will answer them. And then we do another 24 minutes, and then I answer more of your questions. So it's a great interactive opportunity for us to go live, answer any questions you might have. If you're listening live, please put in the hashtag live, hashtag symbol live. If you're listening on a replay, put in hashtag replay. I would appreciate that. That's just my little gift from you to me, because in the world you have to do yin and yang, got to give and take. And so I'm going to give you a lot, but I'm going to ask you to do something in return. Just put in hashtag live or hashtag replay. I don't think that's unreasonable. So, all right, we ready to rock? Hey, folks, Dr. Joe Esposito here. Glad you're with us today. I am going to talk today about something near and dear to my heart, and that's back pain. How many of you have back pain? Raise your hands. A lot of you do. I know you have back pain because I've been in practice for a long time, and there's not a day that goes by that new patients don't crawl in my office saying, Dr. Joe, my back hurts, my neck hurts, I have sciatica, I have headaches. So we're going to talk about the real causes of back pain. We're going to dispel a lot of rumors and myths about back pain, and you're going to be surprised when I talk about surgery. And then we're going to tell you what to do about it. Hopefully we save you a lot of time, a lot of money, so that you can be proactive when it comes to your pain management. Now, I'm board certified in chiropractic. I'm also board certified in pain management. I'm also board certified in non-surgical orthopedics, and I'm double board certified in nutrition. And as far as I know, I'm the only chiropractor in the whole state that's board certified in pain management. So we're really good at natural pain management. Not drugs, not surgery, pain management without that. Now, if you need drugs or surgery, absolutely. We have a medical doctor on staff. We can refer you out to other doctors if we need to. But I want to try to get to the cause of your back pain and not just treat the symptoms. And I know that's a very unique twist when it comes to pain management. Pain management is just that. Let's manage the pain, but we never talk about fixing the cause of the pain in all my pain management studies. So the way the body works is your brain sits up in your skull, and it sends messages down your spine, out your nerves to every cell in the body. So there's a nerve right now that makes your heart beat and your lungs breathe and your eyes see and your toenails move, or your toes move, toenails grow. Everything is controlled because the brain tells it what to do. And 2 things can interfere with that flow of energy from the brain to the body and back up. Could be chemical, could be physical. Now, chemical would be food, drugs, alcohol, environmental toxins. And that's one of the many, many reasons I push nutrition, supplements, biochemistry. I push this so hard because you have control over that. You decide what you're going to eat and not eat. And so you have control over your diet. And most Americans, 70% Americans, have a diet made of processed and ultra-processed foods. Ultra-processed foods means it's not a food or an ingredient that you would find in the average person's kitchen. That means ultra-processed. So if you're eating a 70% diet of processed and ultra-processed foods, that's a lot of inflammation. And inflammation exacerbates the pain. So that's why nutrition is so important. But physically, there's a lot of things that can go wrong with the spine. And let's talk about those physical things and what you need to do about it. Now, you've probably heard the term slip disc. Well, there really is no such thing as a slip disc. But you have bones, vertebrae, and in between the vertebrae is something called a disc. Now, the disc has the consistency of the top of a chicken bone. You know, you eat the chicken leg, and it has that cartilage that you bite it and chew it that I ate at one point in my life, a long time ago. That's the cartilage, and that's the consistency of your disc. Now, it's kind of fluidy, it's kind of mushy, and as you get older, the disc dries out. Desiccates, that's a fancy word for it. And as the disc dries out, it doesn't have the support and the cushion that it used to have. So now the vertebrae are more likely to move out of place, the bones. If the bones move out of place, that can essentially cause a pinched nerve. It's a little more complicated than that, but for today's purposes, it's the pinched nerve. So bone moves out of place and pinches a nerve. You pinch a nerve, it hurts. So here comes logic. If it hurts when a bone is out of place pinching a nerve, what would be the best treatment? We'll put the bone back in place, right? So putting the bone back in place is by far the most effective, least expensive treatment for back pain. So if you have back pain, I believe that's where you should be starting your journey. Most effective, least expensive treatment. So just put the bone back in place. So physically, that's a problem. But there's a problem there. 90% of your nerves don't feel pain. I'm going to say that again. 90% of your nerves don't feel pain. You could have a pinched nerve and not know it. So, for example, you don't feel your blood pressure. You don't feel your spleen. You don't feel your kidneys. You don't feel your thyroid gland. So when I treat a patient, my staff treats a patient, we not only check the nerves that feel pain, we check the 90% that don't feel pain. Because if we take you on as a patient, I don't want to get you out of pain. I want to get you well. There's a difference. Okay, I can give you drugs and get you out of pain, but that's not going to get you well. So we want to test the nerves that feel pain and test the nerves that don't feel pain. And then the third concern I have is what we're going to talk about soon is arthritis. If bones are out of alignment, they rub up against each other and they wear out. So back to this slip disc. So the disc can actually swell. And if you think of a disc, I'll try to give you an anatomy lesson. A disc, if you think about jelly donut, you got a crunchy, a chewy outside, soft but chewy, and then the inside is full of jelly, which is really kind of liquidy. And that's how your disc is. It has a nucleus pulposus, which is your jelly filling, and then the disc, the fibers of the disc are on the outside, like the jelly donut, the dough of it. And if the jelly donut squeezes the jelly out, you can get a bulging disc. Okay, and that's a bulging disc. Now, here's the thing I need you to understand. I can take 100 people right now that have absolutely no back pain whatsoever, and statistically, 39% of them are going to have swollen discs or ruptured discs. They're going to have a swelling in the disc in the MRI. And if it swells, that's one thing. If it ruptured, it's another. But you have a swollen disc. So let's assume you have back pain. You have a 39% chance that you're going to have a swollen disc in that area, and that's not the cause. So you have back pain. We do an MRI. You have a swollen disc. That's reason for surgery. That's protocol. They do the surgery. Didn't work. It's called failed low back surgery syndrome. It happened in the neck too. And it's actually a diagnostic code. Insurance companies have a diagnosis code for that because it's 39% of the time, I guess. I don't know what the statistic is. I think I remember reading about 40%. So if you have a swollen disc and you have back pain, that doesn't mean the swollen disc is causing the back pain. So what I recommend if you're considering surgery, what you do is you have the doctor do what's called a facet block. Now, the bones stack up one on top of each other, and they're connected. The bones kind of, not like a tongue and groove, but they line up and fit together nicely. That's called a facet. Now, in the facet, there's something called the median branch nerve. And many times, 39% of the time, that's the cause of the pain. So the doctor should go in and inject that nerve, numb it. If the pain goes away, that's the cause. If the pain doesn't go away, then it's the disc. So before you have a surgery, and I'm not a surgeon, this is what I would do. Numb that nerve and see if that's the problem. If it is, it's not my disc, and don't operate on my disc. If I inject that nerve and the nerve doesn't relieve the pain, that injection doesn't relieve the pain, then we can assume it's the disc. But I don't want you going there and having surgery without doing everything you can to try to prevent that surgery. That's why I recommend chiropractic first, drug second, surgery last. Absolute no-brainer when it comes to back pain. Now, if I have pain in my back and I'm losing bowel and bladder control, I can't walk. Well, my leg is falling out from under me. Well, maybe that's a surgical case. But most cases, major majority of cases, there's absolutely no need for that surgery with chiropractic and the other approaches. So I'm not a fan of surgery unless you have to have it. And I like working with surgeons who think like that. So don't have the surgery if not. And again, it's protocol you should follow before you get under the knife. So we're talking today about what causes your back pain, and that's certainly one of them. That's the most common, is a pinched nerve. Now, cervical spondylosis, what that means is the discs are wearing out, you're getting bone spurs forming, the neck can get stiff. That's usually due to bones out of place rubbing up against each other. It's osteoarthritis. So osteoarthritis is there's cushions in between the bones. The bones are out of place. They rub up against each other. The disc wears out, and that's called osteoarthritis. Let me make sure you understand this. Osteoarthritis is mechanical. That means the bones are out of place, rubbing up against each other. Rheumatoid arthritis is an autoimmune disease. That's the body attacking itself and causing an inflammatory reaction. That inflammation then puts pressure on the nerves, and that's where you get the autoimmune disease or the rheumatoid arthritis. Rheumatoid arthritis, we want to manage with nutrition. We want to get the inflammation down the best we can, calm down the immune system. The immune system's already overexcited. We need to calm it down, calm down the immune system, put the bones back in place so that they don't wear out physically and become osteoarthritis. And then once we do that, many times that osteoarthritis, rheumatoid arthritis is now manageable. Now, we've talked about this in the past, that if you have an autoimmune disease, whether it's rheumatoid arthritis, whether it's a thyroid condition, whatever it is, if you have one autoimmune disease, your chances of getting other autoimmune diseases skyrockets because your body is attacking itself. And if it attacks the thyroid, it's one problem. If it attacks the joints, it's another problem. Attacks somewhere else, it's another problem. So with any type of autoimmune disease, we definitely want to manage that. And we do that from a nutritional standpoint, and we have supplements we can talk about food changes. But if you have an autoimmune disease, folks, you really want to come see us right away so that we can get that under control forever. Never goes away, but you get it under control. So osteoarthritis is mechanical, not chemical. Now, I've seen thousands and thousands, I guess the other day, between 15 and 20,000 patients in my career. When I take x-rays on those patients, and I oftentimes do, I see osteoarthritis on the x-rays on a regular basis. And when I see osteoarthritis, it's because the bones are out of place, rubbing up against each other. If I see osteoarthritis on an x-ray, that means it's been there for at least 10 years. Osteoarthritis doesn't show up right away. So if you have back pain, if you have neck pain, if you have sciatica, you have muscle weakness, numbness, you need to get that checked immediately. Because you think, well, it ain't no big thing. I would say, tain't nothing. No big deal, tain't nothing. Well, what happens is those bones are rubbing up against each other very quietly year after year, and then 10 years later, it shows up on an x-ray. And I have patients come in all the time, and I say, you have arthritis here. It's been here at least 10 years, if not longer. For even to start to show up, it's 10 years. But, Doc, it only started hurting last week. Let's go back to the way we started this talk. 90% of the nerves don't feel pain, so you can have a pinched nerve and not know it. So, for example, if you're ever in a car accident, and this drives me insane with car accident patients. You get in a car accident. If the car's damaged, you're damaged. I've never seen it any other way. So if the car is damaged, you're damaged. You go to the hospital, you come see us, maybe 1 or 2 visits, and you say, my pain's better. I don't got to finish any more treatment. I want to get this settlement. That insurance company's offering me that money, man, and I want that money. And you settle the case. Okay? Kind of like a parent. I got to let you go do your thing. When you screw up, I'll be there to catch you when you fall. And then here it is 5, 10 years later, the patient comes back in, and I take an x-ray, and sure enough, 10 years later, I'm seeing arthritis. I say, what'd you do 10 years ago? I got in a car accident. Did you get complete chiropractic protocol done? No. Okay. Did I tell you to? Yeah. Now you have arthritis. Oh my gosh, you were right. Yeah, I was right. I have no benefit to lie to you. So if you have pain, you've got a pinched nerve, you're irritating a nerve somehow. Chances are it's a bone out of place. Put that bone back in place. So don't ignore pain. And don't jump to settle especially a car accident case because the insurance company's pushing you to do it. This is your life. Attorneys don't care 10 years from now. Insurance companies don't care. Nobody cares about you. And then you come back in my office and you've got these severe debilitating arthritic conditions because you didn't listen to what we said. So I'm going to get strict with you. If you have pain, you need to come see us immediately. You can book an appointment right on our website, drjoe.com, and you've got to get that fixed because pain is a warning sign. It's telling you something's wrong. If you ignore it, I promise you, you're going to regret that decision. So again, drjoe.com. Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We'd love to see you as a patient. Now, normally the first visit is $940. We've reduced that to $299. So that's crazy. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. So we can get to the cause of your healthcare problems, not just treat the symptoms. And then if you need more care after that, we'll talk about further care. We'll just show you the x-rays. We show every patient their x-rays. Well, Dr. Joe, no one's ever showed me my x-rays before. I've never seen that before. Well, we want you to see what's going on. We have nothing to hide. They're your x-rays. And I want you to know what's happening so that you can make better decisions. And whatever you decide, totally up to you. But I want you to have that knowledge so that when you move forward in life and problems come back and you didn't listen to us, I don't have to say I told you so. You'll say it for me. But you told me that. I know. So pain is a very serious issue, and you don't want to ignore it because if bones are out of place, it will lead to osteoarthritis. Now, other conditions that can cause back pain, something called spinal stenosis. Now, the way it works is you have 24 vertebrae, and they're all stacked up one on top of each other. And they have a hole in each vertebrae. And the hole, when you stack up all the vertebrae, it creates a canal called a spinal canal. And through the spinal canal runs the spinal cord. And that goes from the brain down to the body and sends out branches of nerves to every part of the body. So if the spinal canal gets narrower, it can put pressure on the spinal cord. Remember, the cord runs down through the canal. And so if that's the case, it's usually due to osteoarthritis. The bones are out of place, rubbing up against each other. Again, it's a physical problem, not a chemical problem. And so many times doctors can go in there with surgery and kind of do like a cleaning out the pipes and make the canal a little bigger. But the thing that gets me is I've never heard of a doctor doing that and putting the bones back in place. Ever. Many times if you put the bones back in place, you don't need the surgery. Now, I'm not a surgeon, but I know this from experience. So if the bones are out of place, you got to put the bones back in place to slow down the arthritis. Spinal stenosis essentially is a form of arthritis. And let's see if that helps. Let's assume everything I just talked about doesn't help. We can always go forward. We can do ablations. We can do nerve blocks. We can do surgeries. But let's start out with the most effective, least expensive, least invasive treatment for your back pain. If it doesn't work, we can, what I call escalation of care. Rarely does it not work. In a major majority of cases, it works if the patient does what we say. Again, sometimes patient says, well, I feel better, and I'm not going to come back there anymore. Okay, we'll see you again in a few weeks. And they always come back, and they beg us to take them back. So if you have bones out of place, the only guarantee I can give you is they will wear out. The joints will wear out. That I promise you. And I've seen thousands and thousands and tens of thousands, maybe 100,000 x-rays in my career or more, probably more. And I know when I see arthritis, those bones are out of place. They weren't put back in place in a timely manner. Other things that can cause back pain. How about sciatica? Anybody have sciatica? Leg pain, back of your leg, shooting down your leg? If it goes down the back of your leg, it's called sciatica. If it goes down the side of your leg, it's called neuralgia paresthetica. Either way, it's different nerves. The lower back is usually the fifth nerve. If it goes down the side of the leg, it's the third lumbar nerve. Either way, it's a pinched nerve. And so when you have sciatica, neuralgia paresthetica, back pain, leg pain, hip pain, knee pain, the first thing you want to do, in my opinion, is look at the spine to see if it's misaligned. And if it is, realign it. This is not hard to figure it out. Bone out of place, put back in place. Simple. So sciatica is oftentimes due to a pinched nerve in the low back. It could be the sacroiliac joint that's out of place. It could be something called the piriformis muscle. And this is another thing I've seen people get chiropractic care for, injections, physical therapy, surgery. Nobody ever looked at the piriformis muscle. The piriformis muscle is a little muscle. It runs from your hip, like the outside of your hip bone, and attaches into your pelvic girdle. And when it contracts, it lets your leg rotate out. So if I have my leg and I want to point my toes out, that's the piriformis muscle. If the piriformis muscle becomes weak, it can actually lay down or droop down onto the sciatic nerve. So in that case, we need to strengthen up the piriformis muscle. And there's a real simple exercise. I can't show you because we're on radio. But there's a real simple exercise you can do to help build up that piriformis muscle. And once again, let's not jump to the big picture yet, the big changes yet, like surgeries and injections. Let's see if we can figure out where the heck it's coming from first. Much better approach. So sciatica is a big one. Could be a herniated disc, could be a bone spur. It could be several different things, but let's try to realign things first and see how we do. You could have a tumor growing in your spine. And if a tumor is growing in your spine, that's a surgical case in most cases. So there's non-surgical approaches to it, but that's a medical case. So cancer can spread from a place where it starts I don't know, the lungs, the prostate, and it can get into the spine. So lung, breast, prostate, bone cancers, those are the ones that usually metastasize into that area. Now, there are a few non-cancer conditions that can cause tumors as well. A friend of mine has a hemangiomic tumor in his spine. And his spine is actually, there's blood getting into his spinal cord. And they had to do surgery to get the blood out because the body has no way of getting blood out of the spinal cord. So it's really a very, very rare condition. And I remember he called me up one day from California, and he said, Joey, I need you to come out here and adjust me. My back is hurt, and you're the only guy that can adjust me the way you do. You're the best. I've been to all these other chiropractors. And I said, Johnny, what are you feeling? He goes, well, I'm kind of numbness on my left thigh, and my right foot is weak, and I'm itching in certain areas. And so his pattern didn't fit one nerve. I said, Johnny, there's something going on here. I said, you need to get yourself an MRI. No, I just need an adjustment. I said, no. Your symptoms don't match somebody who should get adjusted. Go get an MRI. If everything comes back negative, I'll fly out and I'll take care of you. And sure enough, he called me up a couple of days later, and he says, I have a hemangioma, a tumor, basically in his spinal cord that's bleeding into his spine. Very rare condition. So he had to have surgery for that one. So if the tumor gets big enough, of course, you can become paralyzed, cause serious issues. But remember, the brain is sending messages along the nerves to every part of the body. So if you have a tumor that's affecting the nerve that goes to your kidneys, it can affect your kidneys now. Not the kidney itself, but the nerve to the kidney. How about your spleen, your prostate, your ovaries, your lungs, your heart? So if we see something that isn't responding to, the basic care that we talk about, that's when we might send you out for an MRI. We might want to get a CAT scan. Might want to get a second opinion from a neurosurgeon. When it comes to spines, I like to see neurosurgeons. When it comes to extremities, I'd see orthopedic surgeons. Orthopedic surgeons can operate on the spine, but my preference is if I had a surgery, I'd go to a neurosurgeon. So tumors in the spine can be a problem, and again, that's something that you want to go medical route, not a chiropractic case. Now, we can do a nutrition evaluation, give you advice to keep the immune system strong, keep the inflammation down, keep the body working the best it can to fight the tumor. And even if you have to have surgery, I want to get you healthy going into the surgery, and I want to keep you healthy coming out of the surgery. So that's why it's so important. Let's get you as healthy as we can, as quickly as we can, so that regardless of what the outcome is, this back pain, you're ready for it. But again, in most cases, it never goes to the extreme. It never goes to the surgery anyway. Scoliosis, this is an important one. I went to a seminar last weekend, and I was the only chiropractor. It was all medical doctors. And there was one medical doctor, a young couple. They were married. They were both MDs. And she had, very pretty girl, but boy, her left shoulder was so high, she actually leaned sideways when she walked. And I thought, she's got an incredible scoliosis. And many times the approach would be, let's put you on a brace, let's try to straighten out the spine, we'll give you exercises. But again, I've seen countless scoliosis patients in my career. Very seldom, never have I ever heard anyone say they checked the psoas muscle, PSOAS. The psoas muscle runs from your spine to your thigh, and it's your major hip flexor. It's the reason you could lift your leg up. Every single scoliosis patient I've ever seen, and I've seen countless, the psoas muscle is spasmed. If the psoas muscle spasms, it either causes or contributes to pulling the spine out of place. So with scoliosis, chiropractic care, absolutely. No doubt, the sooner the better. And you always got to check that psoas muscle. Because if that psoas muscle is spasmed, we can give you the best chiropractic care, best physical therapy, best surgery. If that psoas muscle is spasmed, it's going to undo almost everything you just did. And it's a simple, easy, painless procedure. It takes about 20 seconds to get the psoas muscle out of spasm. So when we approach patients, I always look at it like I'm Columbo, Detective Columbo. I'm going to find out what caused this whole thing. And let's go down that rabbit hole and let's see, is it the psoas? Is it the piriformis? Is it a digestive issue? Is it a nutritional deficiency? Is it a chiropractic case, a surgical case, a physical therapy case? Let's find out the best route of treatment for your specific case. Maybe it's not chiropractic. Maybe it's not surgery. Maybe it's not an orthopedist. But many times you go to one of those doctors and they say, yep, you're here. I would say if you're a barber, everybody needs a haircut, All right, folks, got to go to break here. If you have any healthcare questions, send them to me through my website, drjoe.com. If you want to make an appointment to come see us, drjoe.com. We'd love to see you as a patient. Follow us on social media at Dr. Joe Esposito, Facebook, Instagram, YouTube, TikTok. We post every single day. We're going to post you 1-minute health tips every single day. It's absolutely free at Dr. Joe Esposito. So at Dr. Joe Esposito, drjoe.com is the website. Book an appointment, send you questions. If you'd like to set up a chiropractic evaluation, nutrition evaluation, we can even do it virtually if you want to. So drjoe.com is going to be your source of information. I'm Dr. Joe Esposito. We'll be right back. All right. You got questions?
I might have one or two.
Or 5 or 10?
What about C5, 6, and 7?
What about them? Yes, they are vertebrae. Yes, they can come out of place. Yes, they can cause neck pain, shoulder pain, arm pain, hand pain, wrist pain. 4, 5 is going to affect the thyroid. 6, 7 is probably going to affect the heart and lungs. So, yeah, they got to be adjusted too.
Let's see. Probably a good idea to get another MRI if the lower back fusion was in 2020. Yep.
Could it be a good idea? Wouldn't be a bad idea to have one just to make sure everything stayed. And MRIs are, if you're paying cash for an MRI, I'm going to let you in a little business secret. You're paying cash for an MRI, they're pretty inexpensive, $400 or $500. So, yeah.
My last MRI was like $220.
$220, yeah. So, and if you need help with that, I can refer you to a place that can help you with that. Multiple different MRI places. So, yeah, it wouldn't be a bad idea to get that followed up on and just to make sure everything's right, because you don't want to wait 5, 10 years from now and say, oh, had I got to this 5, 10 years ago, I wouldn't have nearly the damage I have now. Because with the spine, you don't get extra parts. The older you get, it's hard to get parts for these old bodies. So you want to take care of them. What else you
got? Somebody with rheumatoid arthritis for the last 25 years. Do you have, I know that's most of the show today.
That's most of the show today, yeah. That's an autoimmune disease, like we said earlier. You want to get the, if you go to my website, drjoe.com, and just type in autoimmune, we did a whole show on autoimmunity. So you want to treat it as an autoimmune disease, which is what it is. The 2 things you want to give up right away, right now, starting today, are wheat and dairy products. Those are the 2 foods that really just blow up your immune system. Supplement-wise, Super Green, Essential Source, vitamin D, nitric oxide to increase circulation, glutathione to clean out the liver, turmeric to bring down the inflammation. Now you're saying, but Dr. Joe, that's 5, 6 supplements. That's extreme. No, rheumatoid arthritis is extreme. Being crippled up is extreme. Not being able to move your hands, that's extreme. Taking 4 or 5 supplements a day, 6 supplements a day is not extreme. And way less expensive, too, by the way. So you listen to the show we did on autoimmunity, and I think we did one on rheumatoid arthritis, too. Just type in arthritis. And then if you still have questions, either way, make an appointment to come see us. Because that's something we need to do from a chemical standpoint and a physical standpoint.
All right. This person has mild scoliosis as well as a lot of muscle spasms throughout the body.
Yeah. So, if you're local, love to see you. I'll show you how to check the
Speaking of, where are we?
Where are we? I am upstairs in our building right now on Barclay Circle. And where are the offices? In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb.
And for anybody that needs physical attention that might be far away, what can we do for them?
We could try to find you a doctor in your area, but I get this question probably 5 to 10 times a week, because we have, between all our social media, close to 1 million followers. I need somebody who does what you do in Sydney, Australia, in London, in Dublin, in South Africa. I don't know who does what we do in Marietta, Georgia, which is where I am. So we try to find you somebody, if we can, that can work with you. I just referred somebody up to North Carolina because I have a friend of mine up there, so it was easy. But if you're local, we'd love to see you. That's the best thing. But we could always do a virtual consultation, at least get the nutrition and the chemistry organized. So with the scoliosis, yeah, you want to get that treated because I promise you it's going to get worse. It's not going to get better on its own. It never does. Check the psoas, check the piriformis, find out where the wedge is. It's called, the wedge is where the scoliosis begins, the vertebrae wedge out, and then what we need to do to try to correct it the best we can. I've had countless patients. In fact, way back when I first got in practice, I was dating a gal, and she had really bad scoliosis. And I remember on the wall of my office, in my 5th adjusting room, I stood against the wall and I drew a little line with a pencil. And then as we started treating her, I'd go like a kid. Yeah, and she actually grew about 3 inches once we started straightening out her scoliosis. Now, again, she was 20, so it was a little easier back then when you're younger. But yeah, so we want to get you in as soon as possible to see us. What else? He's analyzing. He's thinking.
Nope, just statements.
Okay, just statements. Yeah. He's reading.
That's it for now, guys. Oh, here we go.
But wait, there's more.
Hairstylists constantly on their feet, starting to notice that I have mild pain on my lower side of my thighs.
Yep.
Question is, what shoes do you recommend to wear?
Uh,
And are shoes really the culprit, or
shoes aren't the culprit.
but can help?
Can help. I like Skechers because they're light. It's what I'm wearing right now. They're not durable, which I'm upset with. And I can't walk. I went to Music Midtown, which is a big music festival here in Atlanta, and I wore them. And they're good for standing, but walking in mud, because there was a lot of mud there and everything, it wasn't the most stable shoe. I like Merrell's, actually, for hiking and things like that. But I wear my Skechers every day because they're light. But it's not your shoes, okay? What's happening is you're leaning forward, you're putting abnormal stress on the back, you're taking the curve out of the low back, you're transferring your weight forward onto your knees, that should be on your spine, and so that's really a chiropractic case. And I don't have a quicker answer for you for that. You really just need to get to us or somebody and get that taken care of. So
I'm going to throw a brand in and say Olakai.
I don't know Olakai.
We used to spend, several months a year in the Bahamas. Every bit of flooring anywhere is either concrete or it's some form of stone. So my mom, who would spend 2 or 3 times that amount of time there, the only shoe that she found that she could wear as like a flip-flop, something casual, was
Right.
Olakai. Now they make regular shoes,
Oh,
but they're really, really big on their insoles.
yes.
They support the arch. They do a really good job.
Oh, I never heard of him, so there you go. Garrett gives you an endorsement, Mr. Olakai, Mrs. Olakai. Good for you. You went to Cabbage Beach when you were in the Bahamas?
Which one?
Cabbage Beach?
Well, that'd be Nassau.
Oh, that's Nassau.
Yeah.
Okay. All right. Oh,
Yeah.
No, it's Bahamas.
That's for the regular folks.
We slum people. I went diving down there once. A lot of cool diving areas. Old planes that crashed from an old James Bond movie. We dove that and everything. So yeah, nice time.
No, I love Bahamas, and
Yes.
Nassau is beautiful. One more, and then we'll move on.
Okay.
Vionic and Spenco orthopedic shoes are good if you have no arch, apparently.
Okay, never heard of those brands either. So there you go. We're helping each other. That's what we're here to do. Help each other out.
All right.
Ready to go on part 2? Here we go. Hey, folks, Dr. Joe Esposito. We're talking today about what causes your back pain. And there is no one specific cause. There's a lot of different things that it could be. And that's why it's so important that you go to a diagnostician, somebody who can diagnose the cause and not just say, oh, you have back pain, here's some steroids, here's an injection, let's do surgery. No, we want to find out what's causing it, because all those things are great if they needed, but that doesn't treat the cause. It may treat the symptoms. Now, surgery might treat the cause, but there's always a lot of side effects. Just going under anesthesia is a big risk. Now, the more anesthesia you have as you get older, it builds up, because it basically shuts your brain down. You don't feel anything, and then it kind of reboots the brain, and the brain may not reboot like it did before. And so I want you to avoid anesthesia at all costs. I want you to avoid surgery at all costs. But if you need surgery, absolutely. But my feeling on surgery is this: only after all other options are exhausted. I have a family member, and she had hyperthyroidism. And we tried everything, and it was genetic, and it was bad. Needed surgery. But that doesn't mean that you don't try everything first. In fact, I remember going to the hospital, and the doctors kind of looking at me. I'm like, well, what's that all about? And finally, one of the doctors comes up to me, he says, I got to say it, Dr. Joe, I'm your biggest fan. He says, I listen to you all the time. He said, I think you're brilliant, and all of us here is just excited that you're even in the hospital with us. That's kind of cool. So you want to try to exhaust all avenues first before you go to the extreme, which is the surgery. So when it comes to the spine, in most cases, chiropractic care, again, most effective, least expensive treatment for back pain. You got to get on an anti-inflammatory diet to bring down the inflammation. I have a traumatic brain injury. I was hit by a car when I was 10 years old, and they thought I was dead. They laid me on the side of the road, covered me up. I mean, it was really severe traumatic brain injury. And I, for all intents and purposes, should be dead with this type of injury, severe trauma to the brain, the spinal cord. And I take care of my brain now, of course, because I know that. But there are certain things that trigger my pain. And I still have pain from this injury. Traumatic brain injuries never go away. You just manage them. And I can't do caffeine, even a little bit of caffeine. I was somewhere the other day and somebody wanted me to taste this tea. It was a tea. It had some black tea in it, which has caffeine. Very, very little. And I said, a little bit shouldn't hurt me, right? Bam, headache that night. Chocolate, caffeine, monosodium glutamate. Certain Chinese foods with monosodium glutamate will blow up my headaches. And so, yeah, we want to get the chemical aspects managed for you as well. And what I tell people, too, is I say, get a diet diary. If you go to my website, drjoe.com, and under patient forms, there's something called a diet diary. Print it up. It's free. I don't know you're there, And write down everything you eat. Everything. If you have a piece of gum, if you have a snack, if you have a piece of candy, everything that you're eating. And then in the margin, monitor your pain levels. It usually takes 2 or 3 days. It's not a big project. And you know that, gosh, I had coffee and I had a headache. Oh, gosh, I had too much sugar and my back started hurting. You'll be able to see the pattern pretty quickly in most cases. If not, I can analyze it with you. And you say, oh, my gosh, I can't do caffeine anymore. I can't do caffeine. I wish I could. I'm going to get a little rush like everybody else has. 90% of the world, by the way, has caffeine every day. I think it's 80% of Americans, but you take the whole world, 90% of the world has caffeine every day. And I can't do that. So I have to actually get natural energy. I take things like nitric oxide, which opens up my blood vessels, B-complex, which is so important for brain function. So instead of giving me just a rush of energy with negative side effects, I give myself a rush of energy with positive side effects. Things like Dr. Joe's Super Greens, Dr. Joe's Essential Source. If you're not taking those, by the way, you should. It's a minimum supplements everybody should take every day. And they're 2 powders. They taste great. I mix them together with coconut milk, almond milk. If I want to get crazy, I'll throw a half a frozen banana in a blender. But if you're not taking Super Greens and Essential Source, I don't know why you're not. In fact, Garrett and I, right before we started doing this, we just started talking about another supplement on the market, twice the price of Essential Source, a fraction of the ingredients, but a huge marketing campaign. So this is half the price and has a lot more benefits to it. So I take Super Greens and Essential Source every day. I think you should too. But that can help bring down the inflammation. Turmeric can bring down the inflammation. Nitric oxide gives you energy. B vitamins gives you energy. Adrenal support gives you energy. So if you start writing down your pain and what you're having reactions to, and let's say it's coffee or artificial sweetener, you're then going to have to decide, what can I do to replace that? And I've got those answers for you. So nutrition is really important when it comes to pain management because you're causing inflammation in the body, and certain foods are actually triggers for that. Fried foods, we talked about omega-6 fatty acids, how dangerous they are, how they cause inflammation in the body. So if you don't know what to eat, by the way, I'll go off on a tangent here. I know we're talking about back pain today. Go to my website, drjoe.com, and just type in the search bar, so what can I eat? So what can I eat? And listen to a show we did. And that basically breaks it down. Breakfast, lunches, dinners, snacks, parties, raising kids, all there. It takes about 45 minutes to talk. And if you want to know what not to eat, then type in 7 deadly sins of nutrition. So if you want to do it in order, 7 deadly sins of nutrition first, then so what can I eat? And there it is. There's your Diet 101. Laid out for you, simple, easy, no charge to search my website, and you'll be amazed at some of the things you're doing that are making your back pain worse. A famous guy once said, forgive them, for they know not what they do. Well, yeah, now you know. So just prepare yourself. Once you listen to 7 Deadly Sins of Nutrition, so what can I eat? There's no excuse to say, well, I didn't know that. I just told you. I didn't know coffee gives you headaches. I just told you. So there's a danger of listening to my shows because you're going to learn something. And you can't use it as an excuse. Ignorance doesn't float anymore once you listen to these shows. So we're talking today about back pain, and we're talking about causes of back pain. And kyphosis, that's the hump. You start getting that hump in the mid-back. Sometimes that's caused by fractures in the vertebrae. And the vertebrae fractures and the body leans forward if it fractures and crushes down in the front. But what I'm seeing now is tech neck. People being on their phones, bent over all day, every day, and I have my phone. I'm guilty of it too. But if you do that over time, your body will change its structure. You'll develop that kyphosis, that hump in the back. And that puts a lot of pressure not only on the nerves, but you're now compressing the lung field. Your lungs are right there in the front, when you're covered by ribs. And as you start to hunch over, you're compressing your lung field, so you're not breathing as much as you should be or could be, and you're not getting enough oxygen. You're putting stress on the stomach, so you're not digesting your food properly in many cases. So when I see that humping forming, I want to get that fixed as quick as possible. And you can do exercises, and you can do, lay on a roller and wear these braces, and all that's good. But you need the chiropractic component to put the bones back in place as well. I've never seen it work without the chiropractic component. So if you have bones out of place, put them back in place. Other conditions. There's a condition called ankylosing spondylitis, and it kind of goes along with rheumatoid arthritis. It's an autoimmune disease. So what that means is the body starts attacking itself, and it attacks the joints. And in most ankylosing spondylitis cases, it's usually men more than women. Young men get it more often. The hips start to fuse together, the sacroiliac joint. And then it starts to work its way up the spine. It starts the fifth lumbar, fourth lumbar. And it's an interesting condition because it doesn't cause the discs to wear out. You kind of grow bone spurs, we call it candle drippings, between the vertebrae, and the bones kind of fuse together around the disc, and it works its way up the spine. The worst case I ever saw was a woman. She came to me from Africa, actually. I don't know, I can't remember what country it was, but she didn't speak good English. Whoever was here had to interpret for her. And the ankylosing spondylitis was so bad that it had worked its way up all the way into her thoracic area, her rib area, and it was fusing her ribs together. And she couldn't breathe. And we tried desperately to keep those bones mobilized because really the only manual treatment for ankylosing spondylitis is chiropractic care. Keep those joints loose. And I've had people for 20, 30 years have it, and it doesn't affect them anymore. Keep the joints loose, get their diet straightened out, keep the immune system from attacking, and they're fine. She was so far gone. I mean, she'd come in and her eyes would be popping out, and she's gasping for air. And unfortunately, she died. But she got to us too late. Because I know when I see these ankylosing spondylitis cases early on, I've never had anybody even get close to that level of fusion of the spine. So, if you have autoimmune diseases, if you have one, chances are you're going to get others. So if you have Graves' disease with the thyroid, you have rheumatoid arthritis, ankylosing spondylitis. If you have one, your chances are you're going to get more. So that's why we've got to maintain and stabilize that immune system as quickly as possible. And I'm happy to work with you if you have those conditions. We can do a nutrition evaluation, ankylosing spondylitis, and osteoarthritis chiropractic care to keep the joints mobile. So we have protocols for you. But the only promise I can give you, I can't promise I can help you, but I can promise you it's going to get worse if we don't help you. And that's unfortunate. And it breaks my heart. Like this young lady, I mean, she came to early in my career, and I've been in practice 39 years now, early in my career, and it breaks my heart to think, had I gotten to her 10 years earlier, what a different life she would have had, probably still be alive today, I'm guessing, and how many people it affected, her condition and her disease, and then eventually her demise. So you never know how far, and this is not me, this is our founder, BJ Palmer, a developer. You never know how far-reaching a thought, deed, or action will be today and how it's going to affect millions of people tomorrow, something along those lines. And so when you get healthy, how many lives is that going to impact? You, your friends, your family, your children, your spouse, your church, your work, your social life. I love what I do. And in 39 years, I've missed a half a day of work in 39 years. I love what I do because I see the impact that it has, and I don't know how far-reaching it ever was. And that's so rewarding. And I want you to experience that. I want you to experience optimum health, extreme health. Second book I ever wrote, Prescription for Extreme Health. I want you to experience extreme health, not moderate health, not I feel okay today health, extreme health. And when you get to that point, it's amazing. And you do that by keeping the nervous system working, the digestive system working, and your diet straightened out. That's it. I got your formula. Nervous system, digestive system, diet. Is it going to fix everything that ails humanity? No, it's not. But it's certainly going to make everything a little better. I was at a seminar the other day, and I was talking to a plastic surgeon, and he had a great line. He says, I don't save lives. I just make lives a whole lot better. And I thought, what a great line. He says, because again, he's not a cardiologist. He's not a cancer doctor. He just does plastic surgery. And I like that. I stole it from him. I said, I'm going to steal that from you. He says, okay, go ahead. So we want to save lives and make lives better. And why wouldn't you want that? Why wouldn't you want everything you could have? While there is time, let's go out and feel everything. Steve Winwood. Let's go out and feel everything. Let's go experience everything we possibly can. And you do that by experiencing extreme health. Nervous system, digestive system, and diet. I want to be your doctor. My team of doctors want to be your doctors. We want to get to the cause of your problems, not just treat the symptoms. And when it comes to spinal issues, I get real passionate about that because I'm really good at that. And so my team of doctors. And the biggest complaint I get is, why didn't I do this sooner? Now, there are some things that are beyond our work, like a spinal cord injury. You can have a fracture of vertebrae, push into the spine. Years ago, I remember, I went to a spinal center here in Atlanta. And they're very famous around the world, and they do amazing work. And I was dating a gal, and she worked there. And I met with the founder, Mrs., I won't say her name. And I said, and I was early in my career. I was probably first year out of practice. I said, I want to come and work here 2 days a week. I'll do it absolutely free. Let's work with these severe spinal injury cases, these people that are paralyzed, people on ventilators that can't breathe or go to the bathroom by themselves. Let's see what happens. She was thrilled, over the moon excited. And she went and talked to her board, and she called me up one day, and she was crying. And she said, I'm very sorry, Dr. Esposito, but my board says we only work with doctors that work within the hospital. And I said, okay, put me on staff. It's a pretty simple answer. Well, we don't have a position for someone like you. We have categories of who we hire. We don't have a position for someone like you. Create the position. And the bureaucracy just got so bad, and she cried. And she said, I wish you could be here because I know you could help out people. So they didn't have the option to bring me on board, but you have the option to come see us and get to the cause of your problems. And we'd love that opportunity. So drjoe.com. If you want to make an appointment, drjoe.com, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And we can get you in this week. We have appointments in all 4 of our offices every week. We leave appointments open for new patients. So if you'd like to become a patient, drjoe.com. If you can't come see us, if you want to do a virtual consultation, we can do that too. And just book it through the website or call us. The phone number's on the website. And we can go ahead and get that set up for you. We can send you a Zoom link and we can do a virtual consultation. So drjoe.com, I want this to be your lifeline. I want this to be the place you go for your health problems. And if we can't help you, we probably know somebody who can. So we'd love to be your doctor, drjoe.com. Normally the first visit is $940. We've reduced that for my listeners to $299. Exam, x-rays, consultation, first treatment, going over the x-rays on a follow-up visit, and a complete nutrition evaluation. drjoe.com. Don't pass up the opportunity to experience extreme health. And if you do, it's your own fault. Don't be like a lot of patients say, why didn't I do this sooner, Dr. Joe? I've been to come see you for 5 years, 10 years, 20 years. Had somebody come in the other day, Dr. Joe, I heard you speak 35 years ago at my high school. So the guy was 55 years old now, or whatever, close to that. And he says, I've been meaning to come see you ever since. I've been in the same building for that long. I don't like change. I like consistency. So drjoe.com, don't be silly. Make the appointment. So with spinal cord injuries, again, we may not be able to treat the fracture, but maybe we can adjust above and below the fracture. We can get the muscles working. We can get the digestive system working, get you on a good diet. I can't tell you how many patients I've had that are on feeding tubes. And I'll say, at least take Super Greens and Essential Source, mix it in with the food, and feed it to the feeding tube. Inevitably, I get a phone call, wow, whoever is doing better. It may not cure their problem, but they're doing better because now they're getting nutrients. Because I see some of the junk that they feed them through these feeding tubes, and I want to scream. Soybean oil, omega-6 fatty acids, blows up the immune system and increases inflammation, and you're giving it to somebody who's already compromised, can't even swallow food. And you give them soybean oil. You give them sugar. You give them artificial sweeteners. All right, I got to calm down. I'm getting excited. Because that just drives me nuts when I see people doing that. Take an avocado, smash it up with some Super Greens and Essential Source, mix it with some soy milk or almond milk, and put it through the feeding tube. Don't even have to use milk. You use water. Watch what happens. Add adrenal support. Add B vitamins. Add omega-3 fatty acids. Add digestive enzymes to that. And it's wild to watch people do so much better. Well, the hospital doesn't have that because, well, that's expensive. Well, I don't care if it's expensive. It's my loved one. I want them to get the best care they can. It's not expensive. It's pennies, literally pennies a day for each supplement. I don't know why the world doesn't do it. Anyway, I get back to where I was. Let's talk about pain. Talk about spinal cord injury, a fracture. There's a very common fracture that I see. It's called spondylolisthesis. And spondylolisthesis can happen anywhere in the spine. Usually it's in the low back, the fifth lumbar vertebrae. and the bone fractures, and if it goes into the spinal cord, you can be paralyzed. If it pushes away from the spinal cord, it's called a spondylolisthesis, and it happens in things like football and hockey and falling on your butt. I have this condition. I have a severe spondylolisthesis, and through chiropractic care, I've avoided surgery and probably will for the rest of my life. But if you look at my x-ray, and if I was a surgeon, I'd say you need surgery on that right away. But I stabilize my core muscles. I get chiropractic care on a regular basis. I stay on an anti-inflammatory diet. And because of that, I'm still walking. So I have a traumatic brain injury, severe traumatic brain injury, it's called. And I have a fracture in my low back. Now, did they happen at the same time or not? I don't know. But I have both. And so those two spinal injuries, either one of them, I should be disabled at my age. And probably in a wheelchair. And I'm not even close. So trust me, as a personal experience, talking from somebody who's been through this stuff works. And it works great. And if I could avoid surgery for another 50, 60 years, I'm going to go for that. Maybe in 60 years, I'll submit to a surgery, but we'll see. I'm smiling when I say that. Claudia-Equina syndrome, that's when there's pressure on the low back, on the spinal cord in the low back. That can be a tumor, it could be a fracture, it could be a herniated disc. That's when you usually see symptoms down both legs. You'll see numbness, tingling, muscle weakness, and that's when we start having problems, loss of movement, bowel and bladder control issues. Many times that's a surgical case. When I see bowel and bladder issues, immediately I send you out for an MRI and to a neurosurgeon. That's an emergency. Pain without loss of bowel and bladder, that's something that we usually can manage at any level of pain. In most cases, not all. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about why does my back hurt and different causes. So you want to get the bones lined up the best you possibly can as quickly as you can. That's the most common, most effective, least expensive treatment for back pain is chiropractic realigning the vertebrae. Number two, we want to get you on an anti-inflammatory diet. We want to bring down the inflammation. We want to find out why you have inflammation and bring it down, because no matter what health condition you have, there's inflammation involved. And if we can bring down that inflammation, it's only going to be a positive effect. So that's why diet fits into pain management so well, and it breaks my heart when I talk to pain management doctors and they do zero when it comes to diet. They'll do injections, they'll give you pills, absolutely, and they're really good at that. I can't do that. I don't know how to do that stuff. But I'm really good at putting the bones back in place and getting a diet straightened out. And so a lot of doctors will actually send their patients to us and say, hey, can you do a nutrition evaluation on this one? Surgeons, this is a common one with surgeons. The insurance company says, well, Garrett, you're too fat and we're not going to allow surgery because you're too high a risk. You have high blood pressure. You have diabetes. You're too high risk for surgery, so we're not going to let you have the surgery. First, I call BS on that one because they're saying that it's too high a risk. The doctor should make that decision, not the insurance company. They're just saying it's so they have to pay for the surgery, in my opinion. I don't like insurance companies, in case you don't know that yet, because they don't pay for what they say they're going to pay, and they lie. And so anyway, the surgeons will say, well, Dr. Joe, why don't you take a look at these people and let's see if you can get their diabetes under control, get their weight down, get their digestive system working, get down their blood pressure naturally, so that then hopefully the insurance company will give us their blessing and let us operate on them. Well, a lot of times we get them well enough, they don't need the surgery. And I tell the surgeon right out, listen, man, you might lose this patient. Not to death, but to them coming back to you. I say, well, we're not going to operate on him anyway. They said they can't afford the surgery. Insurance company doesn't want to pay for it. If we lose them, we lose them. And it's kind of fun. I like watching those patients make a turnaround. If you do what we say. And that's your goal. That's your choice. Do you want to do what we say or not? So when it comes to back pain, so much of back pain is physical, not chemical. And that goes for headaches too. Physical, not chemical. Now, we can do medication, we can do injections, we can do drugs, if whatever it is, but you also got to realign everything. And every day of my life, I think, why doesn't the world get that? That is such a simple, easy concept to understand. Tires in your car out of place, put them back in place. Bones in the body are out of place, put them back in place. Now, we can do chiropractic. We can do PRP. PRP is we take your blood, spin it down, and take out what's called the platelets. And the platelets we can re-inject back into the joint to help try to stimulate new tissue growth. Usually very effective on knees, shoulders, elbows, We're soon going to be doing it for erectile dysfunction, urinary issues. If women cough or sneeze and pee themselves, we can do PRP for that to tighten up the muscles, increase blood supply. We have a machine called acoustic wave therapy, which is great for pain management. It sends impulses into an area. Let's say it's my shoulder. Breaks up scar tissue, increases circulation, recruits stem cells into the area to try to grow new tissue. That's totally outside the body, totally non-surgical, non-invasive. Very effective, and usually only need about 6 treatments for it. That's pretty cool. So we take the chiropractic care and realign the bones. We do the acoustic wave to stimulate new growth and break up scar tissue. If we need to, we then escalate the care to PRP, or exosomes, which we inject into the area to try to grow new cells. We have a medical doctor who does that. So now we have so many options when it comes to pain management before we even mention surgery. Before you even mention injections, drug injections. So if you have pain, neck pain, back pain, shoulder pain, numbness, tingling, headaches, blurred vision, dizziness, muscle weakness, come see us. And if it doesn't work, I always say, if it doesn't work, so what? It didn't work. Very low risk, very high reward. If it doesn't work, we can always go to the next level. But in most cases, the results are spectacular. So if you want to make an appointment, drjoe.com. Normally the first visit is $940. We've reduced that to $299. Exam, x-rays, consultation, first treatment, and then going over the x-rays, and a complete nutrition evaluation on a follow-up visit. We accept people with all insurances. Sometimes your insurance doesn't cover, but we still accept you. We have payment plans for those folks. It's very effective, very affordable, and you'll regret not doing it. So drjoe.com. If you'd like to set up a virtual consultation for nutrition or just pain management, you can do that through our website, drjoe.com. Just book an appointment. We'll call you and turn it into a virtual meeting for you. And the supplements we talked about, nitric oxide for circulation, Super Green's an essential source, the minimum supplements you should be taking, turmeric for inflammation, B vitamins for nerve function. All of those and a bunch of others are on the website, drjoe.com. Just go to the tab that says store. But folks, I've been in practice 39 years. My goal is to get you well and keep you well, if possible, without drugs and surgery. So again, the website, drjoe.com. I'm Dr. Joe Esposito. Boom. All right. You have questions?
I have a few. Are any of those treatments covered by Medicare?
Yes. How's that for an easy answer? There's different Medicare policies, but Medicare itself does cover, yes.
What causes heel pain in one foot?
It could be the scar tissue forming in there. It could be plantar fasciitis. It could be the bones out of place. So in cases like that, you want to check the nerve in the low back that controls the heel, because sometimes that's it. It's coming from the back. Number 2, you want to adjust the foot, put all the foot bones back in place. Number 3, we may use acoustic wave therapy to break up any scar tissue and a plantar fasciitis. But again, pain is a warning sign. It's telling you something's wrong. Don't ignore it. What else?
Does chiropractic neck adjustment cause stroke or tear in the artery?
You have a higher risk of getting a tear in the arteries, washing your hair, and leaning your head back than you do from a chiropractic adjustment. So in the rare case, and I've never had it happen with all my doctors and the thousands and thousands and thousands of adjustments we've given, never had it happen. If you have a genetic predisposition or a weakening of the blood vessels, it could happen. But the risk is higher just leaning your head back than it is from a chiropractic adjustment. So I'm very confident when I adjust patients. So. What else?
That seems to be about it for the day.
Beautiful.
Guys.
All right, guys, again, if you're listening live, put in hashtag live. If you're listening replay, put in hashtag replay. Follow us on all platforms. That's my request from you. I give you all this information, my gift to you. If you would, just go to all the platforms, Facebook, Instagram, YouTube, TikTok, at Dr. Joe Esposito. I forgot to mention that during the show. At Dr. Joe Esposito, and we would love the opportunity to have more followers because it gets us out there. It raises us up in the algorithm. So if you like what you heard, great. I appreciate that. Any questions, send them to me through the website, drjoe.com. All right, Mr. G. That's Garrett, by the way.